Hi, Melissa Boudin, licensed clinical psychologist, and today I'm here to talk about anxiety, what it may look like, what it may feel like, and how therapy may be able to help. So before we talk about anxiety disorders, let's start with what is anxiety. Anxiety is an emotion that you feel when you're worried or fearful about something. Often in response to this, your body tenses up and your mind becomes fixated on the thing you're worried about or fearful of. It can be hard to concentrate on anything else. Anxiety can also affect your appetite and make it hard to sleep. Now, what is an anxiety disorder? How does that differ? Well, an anxiety disorder involves more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. The symptoms interfere with your everyday life and can impact your work, your home life, or your relationships. There are several types of anxiety disorders, but I want to give you just a general overview of what anxiety may look like and how it may present itself. Now, remember, everyone's experience with anxiety is different, but some of the ways anxiety presents itself can be through feelings of restlessness or irritability, or having difficulty concentrating, having muscle pain or tightness, having trouble falling asleep or staying asleep. It may also mean going out of your way to avoid situations that make you anxious or isolating yourself from others. It can include intrusive thoughts, which are unwanted thoughts or worries that won't go away. Some people also develop anxiety disorders as a way of protecting themselves. So if you've experienced maybe a traumatic event in the past, you might feel anxious anytime you're reminded of that event, even if you're safe now. It can also include panic type symptoms like shortness of breath or feeling dizzy or feeling like your heart is racing. Panic symptoms and anxiety symptoms in general can be scary, but they can be worked through and they can be treated. So how is anxiety treated in therapy? Cognitive behavioral therapy, or CBT, is one common type of therapy that can help people with anxiety disorders. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing and fearful situations. Therapy for anxiety can also focus on confronting the fears that are underlying the anxiety in order to help people engage in the activities that they are avoiding. Additionally, stress management techniques and meditation can help people with anxiety disorders calm themselves and may enhance the effects of therapy. Ultimately, the goal of therapy is to reduce the problematic symptoms by teaching you new and healthy ways of coping with the worries and fears that are causing your anxiety. And with collaborative effort, therapy can be very effective at this, and that is why I'm ultimately here. That's what I'm here for. So thank you for tuning in and learning about anxiety today with me. I hope that you found this video helpful.